Children are much more vulnerable to various adverse effects of the environment than adults. Therefore, meeting the needs of a younger generation in the psychological sphere is a crucial element of their successful growth and development. A school period is a time when many boys and girls face considerable mental issues, such as bullying, self-perception, peer pressure, and others. Frequently, the school environment is the trigger of negative emotions. However, at the same time, schools can and should become the settings in which children's psychological issues would be resolved. Teachers, parents, school administrations, and local authorities need to realize the utmost importance of addressing mental health in schools. Psychological health is a problem of high concern among adolescents. The majority of psychological issues have their onset during one's school age. Nearly 14% of youths aged between 12 and 17 are reported to experience a mental health problem at least once a year. At the same time, only 65% of them address someone to receive help. The prevalence of psychiatric disorders among school-aged individuals is a growing concern not only in the USA but also globally. Annually, nearly 10 to 20% of children and adolescents have a mental disorder of some kind, and this number is constantly growing. Furthermore, research findings indicate that about half of adults with mental disorders experience them earlier at some point, typically before they turned 15. These numbers serve as the rationale for paying more attention to school children's mental health. Mental health promotion interventions should be conducted in schools because these institutions serve as a perfect basis for this purpose. Schools are viewed as pervasive environments and the most critical venues for promoting the psychiatric health of children and adolescents. Researchers argue that it is easier to identify mental illnesses at schools and, as a result, it is possible to address them promptly. U.S. children attend school for many years during their developmental period, which makes educational establishments an unparalleled location for identification and implementation of mental health supports. Therefore, apart from focusing on children's academic achievement, schools should pay attention to learners' mental health as a crucial indicator of achievement. Historically, children's and adolescents' mental health issues have been addressed at schools with the help of child psychologists. However, it was typically the case that only individual children's needs were met, based on their behavior's impact on the process of schooling. Meanwhile, school officials must understand that they are responsible not only for teaching children but also for producing well-rounded, well-adjusted citizens prepared to live happy, meaningful lives and to contribute successfully to society. Benningfield and Stephan argue that it is not enough to engage psychiatrists when schoolchildren become ill or when they have complex mental issues to address. Rather, it is necessary to apply psychiatric practice at various stages, informing children and adolescents about the opportunity to receive help whenever they need it. Integration of schooling and psychological health promotion is, therefore, a prerequisite of children's successful development not only in learning but also in social accommodation. One of the best ways to address mental health at schools is through sport. According to Little et al., many sports organizations realize their potential in promoting good mental health. Taking part in sports activities during school years has a positive effect not only on children's physical health but also on their social, cognitive, and psychological development. Frequently, mental disorders are closely associated with one's physical health, including such issues as cardiovascular disease and obesity. Children suffering from excessive weight have enough problems already, but their peers can exacerbate the situation by making fun of obese classmates and causing them psychological discomfort. Therefore, school-based sports organizations have the potential both to boost children's self-confidence and enhance their physical health. Another viable option to implement at school is mindfulness interventions. As Carsley et al. Note, children's well-being and mental health can improve considerably with the help of this approach. Mindfulness interventions have the potential to relieve depression and anxiety in school students. Kabat-Zinn defines mindfulness as the act of non-judgmentally and purposefully paying attention to and being aware of present moment experiences. The inclusion of mindfulness interventions in school programs has the potential to improve students' attendance problems, decrease dropout rates, and enhance academic performance. Whereas schools are institutions primarily aimed at giving knowledge to children, these institutions should not neglect their potential to affect children's mental health. Schools may serve as places where children's mental issues emerge and develop, but they can also function as locations where psychological problems can be prevented and mitigated. It is, therefore, crucial to address mental health at schools since the timely identification of problems contributes to searching for appropriate treatment measures faster and gaining the best outcomes for children and adolescents. StudyCorgi.com has everything you need for successful studies. Writing tools, informative articles, and essay samples. Come check it out!